All right. Hi and welcome everyone. My name is Lisa. I'm the center coordinator with UCSD Parkinson and other movement disorder center. Welcome to day 2. This is our second monthly educational webinar of 2023. Today's session is called Maximizing Care. We'll hear from 2 speakers. First, we'll hear from Adriana, our center's social worker, about building your care team, and followed by Kathy, who is our center's nurse practitioner, talking all about maximizing your clinic visits. Our hope today is that you'll learn some very useful information about making the most of your Parkinson's and related disorders care inside the clinic and outside as well. So a few housekeeping things. So we'll be doing these sessions every month through December. We'll send out reminder emails to register for the next session. All sessions are also recorded and available on the same website that you registered. Any kind of resources or links we can also share via email after the session. So we'll be using a Q&A feature to get your questions answered. You can type in the questions at any time by clicking that Q&A button. Usually it's at the bottom of your screen or where your other controls are located. You can type in at any time, but we'll be answering all the questions with both speakers at the end. So with that, I'll let Adriana take it away.
Thank you, Lisa. I'm going to take a couple minutes just to share my screen. Okay, continue. Let's see if I can do this. Even though I do these things all the time, sometimes it still feels new. Let's start from the beginning. Okay. Thank you, Lisa, for that introduction. As she mentioned, I'm Adriana, and I am the social worker on the movement disorders team. Some of you, maybe you know me, have seen me, or have talked to me in the past. And I always am really excited to talk about building a care team. I think it's really important to think about our own healthcare as a team, not just within the Movement Disorders Center, but to take a step back and to look at the support systems that we have in place so that we can have this team in place as we navigate our chronic disease. And so my hope today is that at the end of these 15 or 20 minutes, that you understand the benefits of having a care team when living with a chronic illness. And I'll describe a little bit about how having people participating in your care can improve the quality of life, not only for the person living with Parkinson's disease, but for the entire support network. So what are some of the care team basics, and why is it important to have a care team? I always talk when I talk to new families that I'm meeting, new people with Parkinson's that I'm meeting, that every person should have an identified care team as they age or when navigating a chronic disease such as Parkinson's. Because this care team, it's going to help us identify supportive services early, and it can also, particularly with Parkinson's, identify symptom onset and optimize treatment. So when we think about a care team, we're really thinking about, who do I have in my corner? Who are the people that know that I'm living with Parkinson's disease? Who are the people that are helping me manage my medical appointments, manage my medication? And not just the professionals, but also who are the people in my life? So who are the people who should be on this team? Clinicians or experts from various disciplines who assess and plan care collaboratively. So that can be your movement disorder specialist. If you're working with our palliative care team, your palliative care physician, if you're working with any of our rehab therapists, your primary care provider. And then on the other end of that, other people on our care team are our supportive network, our support system, spouse, adult children, paid caregivers. These are all people who can be on our team. And so this is just some of the examples. I like to remind people that everybody has, or everyone is different and has access to different people in their lives, neighbors, community, church, community members, family. And so your care team is going to be unique to you and who you have access to and who is a part of your network. But the core of our care team is the person living with Parkinson's disease. Then we include care partners and families, like I mentioned, paid caregivers, your neurologists, your movement disorder specialists, if you're working with a therapist or a social worker. And the hope here, I think, ideally, we would love for everybody to be able to communicate with each other and to have, open dialogue with all of these members. But the reality is there's things called HIPAA, right? So the way in which we protect health information that sometimes creates barriers to communication within healthcare teams and from people outside of healthcare teams. But the intention is to know that all of these different players exist so that hopefully we can facilitate that communication. And if there are barriers to communication, finding creative ways to overcome them. Because I talk about navigating challenges a lot, because as you know, if you're someone living with Parkinson's disease, if you have a loved one that's living with Parkinson's disease, from the beginning, you're navigating different challenges. You're sitting with uncertainty, what the future might look like. There's feelings of fear, of loss of independence, of loss of control. A lot of people with Parkinson's and care partners too can have feelings of shame or isolation. For a lot of people, there's a big loss of sense of identity, changes in their role within their family, within their friend group, and those are all really difficult transitions to have to navigate alone. A big one that comes up a lot, a big challenge that comes up a lot for people that I work with that have Parkinson's, is they worry about the impact their disease and their progression is going to have on their family, and worry about decisions about care. The symptoms of Parkinson's are so complex, so making those decisions and doing that analysis of the risk and the benefit of increasing medication or changing medication or adding on different medications for non-motor symptoms, those are all really challenging. And so navigating all of these transitions and these changes and worries isn't for one person to do alone, isn't for two people to do alone, which is why we talk about building out this care team and why we talk about this framework and why we want people to take a step back and think about, who do I have in my network that's part of my team that's helping me navigate these challenges and changes. I always use this iceberg because it's such a visual and it's something that I'm sure all of you already know because you're living it, because you're learning it, is that Parkinson's is complex. And so there's what we know to be the motor symptoms, which are usually pretty well managed with medication and are very obvious and often people understand what their motor symptoms are. And then there's everything else, all the non-motor symptoms that we really encourage people to understand, to learn about, because a lot of times people don't know it's related to Parkinson's. And the more we know, the more we can communicate with our care team. The speech issues, the swallowing difficulties, anxiety, panic attacks, changes to cognition, pain, changes with sleep, all of these non-motor symptoms are what many people in the support groups that I run or when I meet with them say, it's the non-motor symptoms that are really impacting my quality of life as a person with Parkinson's. Or it's the non-motor symptoms that's really preventing both me, the care partner, and my loved one with Parkinson's from sleeping and impacting us the next day. And so having conversations with your care team about the ways in which symptoms are presenting, it can be really helpful. And making sure that people within our support network that are not clinicians, making sure that they understand what the non-motor symptoms are is really, again, going to facilitate that communication, is going to open up conversation with your clinician about what you're experiencing at home. As we know, Parkinson's is progressive and it can impact cognition and communication. Again, this is why we talk about the importance of a care team, not because somebody isn't capable in this moment to manage their medical treatment and their medication, but because we understand that different changes and challenges may come in the future. And so having a team from the beginning is really going to solidify everybody's role and have a better idea of, who do I have in my corner that's going to help me navigate these changes, whether that's difficulty with communication or changes in mood, challenges with problem solving, difficulty following instructions, hallucinations, delusions. Who can I go to where we can talk about this and be honest about these changes so that we can get these symptoms treated, so that we can participate in speech therapy to help with communication. I think it's really important to recognize that even if now and maybe even for the next 5 years things are good and you can still really manage your treatment and your medications on your own, including people into your care team early on is really going to help feel like it's a team instead of waiting for that crisis point of like, oh, okay, I've been missing medications, I've been off, and that's because nobody's been helping me do this because I've been able to do it independently for so long. A lot of times family members or caregivers or even people with Parkinson's will ask me, well, in what ways can my family participate right now where I'm still independent, there's still so much that I can do, I don't want to burden them early on, but understanding that having a team is important. What are some ways in which as a family member, as a care partner, I can help? Starting with education. So being a part of these virtual symposiums, or the Parkinson's Association has their empowerment every year, really getting information and education about Parkinson's, about resources, that's all going to be helpful. Because if you have an increased knowledge of Parkinson's disease and its symptoms, then it'll be easier to recognize those symptoms, to communicate those symptoms to your clinician with the overarching goal to be better treatment. Also, attending different conferences and reading materials from good sources are going to help identify resources. And if you can identify these resources early on, then you can improve access to them. It happens pretty often where people are doing pretty well, their loved one doesn't need a lot of care in the home, and then they get to a crisis point where something really shifted, or their loved one had an infection and they really took 10 steps back and can no longer be left alone. And now the family's in crisis. And we have to kind of work backwards because maybe they don't know that Medicare doesn't cover non-medical in-home care. Maybe they don't know that there aren't many respite programs out there to help in these crisis situations. If you know that from the beginning, then you can make a plan for if and when, right? Another way in which family or caregiver, and so when I talk about a caregiver, a lot of times people have paid caregivers that are helping at home that can often come to medical appointments or helping manage medication. And so when I talk about documentation, that is one way in which a formal or informal caregiver can help, a family member can help. We often talk about, people with Parkinson's should keep a symptom journal. We know that that's challenging to do, that it's one more thing kind of added on, that it's hard in the middle of being off to remember, I should write this down, right? But if we have that as a role of one of our caregivers or care partner or family member with whom we live, where they can kind of take that moment and say, oh, we just changed medication. Let me just jot down that we're seeing this change. That can be helpful. That kind of goes along to the monitoring and documenting side effects when medications are adjusted. So because Parkinson's is complex, so is treatment of the symptoms. And sometimes we're adding, changing, increasing medication. And we rely as the medical team on the person with Parkinson's and their support network to let us know what they're experiencing in the home. And so a lot of times family members can take that role of monitoring and documenting those side effects, if any, when medications are adjusted. and keeping notes during the medical visit. I know that often we're providing an after visit summary, and that really gives a good set of instructions of what we changed or what you're going to do next or referrals that are pending. But I also know that when we're in a medical visit, sometimes we forget. Sometimes we forget what we wanted to ask. Sometimes we forget to clarify or think we understood. It's hard to retain information. It's a short amount of time. It's a lot of information, some of which we might understand, some of which we need a little time to process. And so keeping notes during the medical visit can help kind of cue our memory. If we're like, wait, what did they say it's called when X, Y, and Z happens? And oh, let's review the notes. Oh, yes. And then we can kind of connect those dots. And then helping with communication. I'm sure all of you know, navigating the healthcare system can be very frustrating. I know everybody who is in this webinar now has had the experience of being frustrated with a big healthcare system, whether it's ours or other ones here in San Diego. And so that's a way in which family or caregivers can often help with referrals, with scheduling follow-up. I often get questions from adult children who maybe live out of state and they say, I'm not there in San Diego to help my parents out, and I'm not sure how I can help. This is a way in which people who are not local can help, making the follow-up calls for referrals, making sure adding them as the proxy on my chart so they can make sure that follow-ups have been scheduled. If there's any insurance issues, having them follow up. So I think there are different ways that people who are living out of state, if they want to help their family, this is a great way to be a part of the care team without being present in the same location. And then the other one is attending medical appointments to support with communication. Going back to that, keeping notes during medical visit, oftentimes people tell me, when I leave my house, I know exactly what I want to ask my doctor. I know exactly what I've been having issues with in the last couple of weeks. And then I get there, and with the stress of the drive and the stress of finding parking and the worry that I'm going to be late, I kind of forget. Some people even say, I wrote it all down on a notepad and I left the notepad at home, or I left the notepad in the car and now I don't have time to go get it. And so having somebody else there who can help and support us with our questions or remind us, oh, remember you had a question about, when you wake up in the morning, is it best to take your medication, right when you wake up, or should you eat a little cracker with it or something? As family members or caregivers, those are ways in which we can prompt and remind so that our loved one with Parkinson's can make sure that they get their questions asked. Again, these are just examples of ways your care team, if you're a person with Parkinson's, can be participating in your healthcare, in your care, and be supporting you as you navigate the different changes with Parkinson's. So I kind of outlined some of these, and it's the benefits of having a dedicated care team. It can improve communication with medical providers. So again, I know that it's not always easy to get medical records and to get your primary care from SHARP to communicate with your movement disorders specialist from UCSD. But if us as the consumer, as the patient, there's some ownership that we can take. We can make sure that we have the ABS from our primary care physician with the changes to our blood pressure medication in a folder that we bring to our movement disorders specialists. So when we're being checked in by the MA and they're asking any changes to your medication, we can, oh yes, here's the latest ABS from my primary care physician so that you can update my med list. They're small things that really can go a long way in terms of making sure that that everyone's doing or is knowing what everybody else is doing. Really important is this empowerment piece, is this piece about education. So having a deeper knowledge of your unique disease and symptom presentations is going to fuel not just better communication with your provider, but can optimize treatment. And that deeper knowledge of your unique disease comes from having a care team, comes from participating in educational seminars like this one, where you're learning about what Parkinson's can look like. Because you might know what it's looked like in the last 5 years, but we don't know what the next couple of years are going to look like. So you really know what you're walking through. And if you can find ways to communicate that, and if your care team, your physician, your therapist, your spouse can also provide you clues with what they're seeing, then we get a better picture. I often think of it like a puzzle. Everybody has pieces of that puzzle. Your movement disorders specialist has a few pieces. Kathy, if you see her as your nurse practitioner, has a few pieces. You, as a person living with Parkinson's, has a good amount of the pieces. And your family, who you live with, your spouse or other people, might have some pieces. And when we put all of those together, then we have a better picture of what we're looking at. When I talk about building a care team and building it early, I also like to emphasize that if we're thinking about our care as a team early on, that's going to build trust between all of the members of our team. And so if your spouse is, you've been just diagnosed in the last few years and your spouse doesn't come to your medical appointments with you because you can manage it, I think that's okay. I think that's appropriate. I think that is, part of respecting your autonomy as a person with Parkinson's and also the time of your loved one. But I do think inviting them to come, if you see your movement disorder specialist 2 or 3 times a year, maybe once a year your spouse comes. Maybe they come in come into the visit the last 10 minutes or the last 5 minutes of your visit, just to share information or hear what changes are being made. I think that's an appropriate way to incorporate people into your care and into your treatment. And I think it's helpful because then everybody can make sure they're on the same page. So maybe your spouse doesn't need to go to every single one of your primary care appointments. Maybe they just go to a couple of your rehab appointments, physical therapy, to kind of see what types of exercises are helpful, to get some insight into changes that you might need to make into the home as a couple. But really thinking about early on, I always kind of give the analogy of, early on in Parkinson's, it really is the person with Parkinson's, you're driving the car, you're steering the ship, right? You're the one who's navigating everything. And maybe your loved ones are in the back seat, just kind of sitting, watching, seeing. And then at some point, as symptoms increase and it becomes more challenging, maybe your loved ones jump to the front seat, to the passenger, and now they're sitting next to you and they're a little bit more involved, but still, you're still driving the car. Later on in the later years of Parkinson's, kind of as it advances and maybe experiencing more difficulty with mobility or cognition, then maybe your spouse is the one driving. You're still in the front seat, but now this person is kind of making the left turns and the right turns and making decisions based on what they know is important to you. And so that trust is going to be important to build from the beginning. And as I mentioned, navigating the healthcare system can be very overwhelming. Even for people that work within the healthcare system, it can be very overwhelming. So having a care team can relieve some of the overwhelm of having to navigate so many different barriers. And so just some quick little points to remember. Your care team should be uniquely tailored to you. Everybody has a different level of support available to them. Not everybody has a care partner or a spouse that they live with. And so when I think about a care team, it really is taking a step back and looking around to see, who, if you don't have a spouse, who is the person that you told that you have Parkinson's? What neighbors do you spend time with? What really good friends are helping you navigate the different challenges or emotions around being diagnosed? And so really thinking about, it doesn't have to look any kind of certain way. My hope is for each one of you as a person with Parkinson's or a care partner to really just think about, who do we have in our network and who are we leaning on as we go through this Parkinson's disease journey. Again, establishing a care team early on can be really helpful to avoid crisis situations, to understand what decisions you might have to make in the future. I call it, peeking around the corner. In palliative care, we call it, building a roadmap. And so it is important to think about, what do I need now? And what might I need in the future? And what types of resources exist that I might need and might need access to? And, do we have them here in San Diego? A really important one that we often talk about is a care team can play a key role in identifying symptoms. Because Parkinson's is so complex, because it impacts everybody so differently. Some people can have all of the motor symptoms, some of the motor symptoms, well controlled, not well controlled. So having a good care team really can help in fleshing out what's Parkinson's, what's maybe something else, blood pressure related, what's diabetes related, what's aging related. So that can give a bit of space to have a clear picture of who's doing what, so that you can get the best treatment possible for that symptom. And really important is that a care team is meant to support you throughout your disease trajectory. And so really establishing it early on allows for the entire care team to kind of be moving through that roadmap together, to find solutions to challenges together, and to think about needs together and really accessing those resources. That is what I have in terms of building a care team. But I really want to answer questions at the end of Kathy's presentation, because I hope that there are some, but thank you so much for your time and attention. I wish I could see all of the faces of the attendees.
Thank you. That was so great. Kathy, I'll let you take it away.
All right, I'm just getting set up here. Okay, does that look okay to everybody?
Yep.
Okay. All right. So I'm Kathy, the clinical nurse practitioner at the Movement Disorder Center at UCSD. And so as a healthcare provider who spends the majority of my time seeing patients in the clinic, I'm hoping to share some things that with you that I feel helps maximize a medical clinical visit, at least from a healthcare provider's perspective. Because I know there's so many things that need to be discussed, and we all feel like there's such limited time whenever you do see your movement disorder specialist. So first and foremost, as a healthcare provider, we always want to focus on safety. So I do want you to know that. The two biggest risks that we generally see in Parkinsonian disorders are the risk for falls and the risk for aspiration. So you may have a tendency to have us focus on things that we think would impact your disease course long term, because if you have these types of injuries, it could lead to a setback, a permanent decline in your condition. So at least how I do things, I always try to be proactive. And these are the two categories that we can certainly be proactive in. First is the risk for falls, and the second is for the risk for aspiration. So falls are dangerous as they can obviously lead to injuries such as fractures and head injuries. And it takes a lot for one to recover from these types of injuries to be able to get back to the pre-injury level functionally. So fortunately, a lot of times we can prevent falls if we're able to identify risk factors early on. Now, generally, when we talk about falls, I know we mostly focus on your walking and your balance, but we also want to know how frequently do you fall and what are the circumstances around the fall. And that is helpful. So because whether you are the person who fell or the person who witnessed a fall, this information provides us with things that we can target our intervention towards. So it would be very helpful if you could identify, remember, or document what happened before the fall, during the fall, and after the fall. Because, for example, we don't want to just assume it's a mechanical fall. So a mechanical fall is when your fall was due to a walking or balance issue. We also actually look for other contributing factors. So for example, we look into did cognition play a role? Did behavior play a role? So in terms of cognition, for example, is the person getting up when they're not supposed to? Because they just simply can't remember that they're not supposed to get up without help. In terms of behavior, impulsivity is very common. A person who will suddenly jump up when they know they're supposed to wait a few seconds for the caregiver to come. We also look to make sure that there's no other medical issues that leads to the falls. In Parkinson's disease, orthostatic hypotension is a pretty common non-motor symptom. So when you're sharing the details of the fall, what we're doing is we're listening. Are there any clues that indicates that perhaps your fall was due to low blood pressure dropping and maybe you almost passed out or you did pass out? Maybe it's a medication side effect. There are certain medications out there where imbalance is known to be a potential side effect. So we would obviously want to address the offending medication and get rid of it or lower the dose. Or if it's your low blood pressure, that we want to deal with your low blood pressure. And there are treatments for that. So that's why the information that you're able to provide us will be able to allow us to be proactive and maximize your visit by preventing injury. So that way that's not something down the line that becomes a bigger problem. So aspiration is when food or liquids goes down your windpipe rather than the esophagus into the stomach as it's supposed to. And consequences from this can include choking and aspiration pneumonia. And the aspiration pneumonia, an infection of the lung, can actually become pretty serious, where it can also spread throughout the body, causing sepsis. And it's a pretty course that people feel very poorly with. So symptoms of this can include coughing on liquids. Some people will say that when they're swallowing food or pills that maybe they feel like something is stuck in their throat. And so we need to know this. And if that happens, we certainly can address this with swallow therapy, which is generally completed by speech therapists, where they will help you, evaluate you, and help come up with recommendations to mitigate this risk for aspiration. They will look into, the speech therapist will look into safe eating habits. For example, maybe they identify certain foods that are easier for you to swallow and foods that you should avoid, such as crumbly types of foods like toast. They also look at safe swallowing. Sometimes straws are a good idea. Sometimes they're actually not a good idea. So that's what they would help evaluate and make that recommendation. And maybe you need thickener in your liquids to make that liquid thicker and safer to swallow. So the information that you provide us at home will then allow us again to prevent these two major risk factors that we often see in the Parkinsonian world. And that way we can make recommendations to then minimize these risks, because safety is always first on our mind. So next, I do want to say that to prioritize, how to prioritize your visit. We don't want to just make it about what the healthcare provider thinks is important, because I know, like I said, we usually focus on safety first, but then we also want to target what you think is important. So please mention at the beginning of the visit any changes since the last visit that concern you, whether you are the person with Parkinson's disease or whether you are the care partner. At the end of the visit, that's really not an ideal time to say, oh, by the way, I noticed that he's dizzy and falling all the time, because then that puts a lot of pressure to try to navigate what's going on, investigate more, and come up with a solution. So always bring those major issues at the beginning of a visit, and that way we address what's concerning for you. If you have trouble trying to determine, well, I don't know what symptoms are related to Parkinson's disease, or if I even should bring it up, because I get that comment a lot. What I find helpful is, if you have time, you can look up what's called the Unified Parkinson's Disease Rating Scale, particularly Part 1 and Part 2, or it's you can also Google UPDRS for short. Part 1 pretty much lists all the non-motor symptoms that we evaluate. Part 2 talks about common motor symptoms that we may also ask about. And so if you have trouble trying to figure out, well, what I don't know what I should know or what I should talk about. I think this is a useful way to go through all the symptoms common to Parkinson's disease, both motor and non-motor. So that way, maybe it'll jog your thinking and your process. Maybe you could talk to family members, get their input, like, hey, yes, how do you think I sleep? Or what do you think of my cognition? And then that way you can jot down any concerns that you can bring up at the beginning of the visit, rather than waiting it towards the end of the visit. And then you feel like your issues weren't addressed because you only had 2 minutes left. We certainly want to know any changes in your medical condition. And so I always want to know about things such as new diagnosis, emergency room visits, hospitalizations. And again, those aren't things you want to save at the end of the visit and say, oh, by the way, I was hospitalized for 2 weeks for my heart. Because sometimes it can be relevant to what we do for you. Usually emergency room visits and hospitalization, that cues us in to think about, well, did anything change in your medication? And so it would be up to the provider to evaluate what happened with you in the emergency room visit to see if there's anything we need to be extra cautious about. So one example would be if you were being evaluated for congestive heart failure, then we would know that we would have to be a little extra careful about keeping an eye on your blood pressure. Because as I mentioned earlier, low blood pressure can be common in Parkinson's disease. So now we would know, oh, this person has congestive heart failure, so I need to watch the blood pressure so they're not too high, but also not too low. Maybe you're being evaluated, your new medical issue, you're being evaluated to see if you need a blood thinner. Well, then we would have to make sure that you're extra careful about not falling, because then if you fall, you can increase your risk for bleeding and not being able to clot appropriately. So from our perspective, it is very helpful if you can bring that up to us. A common scenario I also see too is when people are started on a new medication, and if they forget to tell us, and there's a sudden change in their condition, if we don't know that you made that medication change, we wouldn't be able to evaluate if it was due to that new medication or not. Now, sometimes people do remember to bring it up, like, oh, by the way, these symptoms started when we first started a new medication, but sometimes people forget, which is, common. So I always want people to keep their medication list updated. So instead of sitting there being frustrated, you can't remember the name of the new medication, you can always give it to your provider. They can quickly screen it, and maybe they'll say, oh, I noticed you're on a new medicine that can actually cause imbalance or affect cognition. And that seemed to coincide with when you said that these things are declining. Because you don't always want to assume it's a decline in your condition, because I think that's what most people do. They say, oh, I just thought my Parkinson's is getting worse. But we always want to make sure that it's not related to something external, like a medication change. And as Adriana mentioned, I know it's frustrating coordinating all your medical cares, especially if you have your medical care in different healthcare systems. And so we do rely on the patient and the care partner to pull this information for us. I know a lot of people are being told that the electronic medical charting systems nowadays, the records are linked electronically, and they are, but in reality is we cannot see your entire chart. And there are times when we can only see bits and pieces of what happened when you went to this hospital elsewhere, or you went and saw the specialist at this facility, and it's a completely different facility from where you get your movement disorder care. And then the patient's being told, well, the electronic systems are linked. And again, they may be linked, but we can't see everything. So we do, at this moment at least, we're still relying on the care partners, the patient, to bring that information to us so that we can update our chart with the latest in your health. The electronic medical records, I mean, they're constantly improving. So I hope that one day it will be to a point where we can see everything. But until then, even if somebody tells you, I would still take that information down to bring it to your movement disorder specialist. But hopefully in a few years, that'll be less of an issue. But as of right now, it's not true that we can see everything that happens when you go to a different medical facility. So that's why it's important, if something happened to you, if you have a discharge form, usually they'll give you a discharge paperwork, bring that to your appointments. If you have a medication change, please update your medication list. Ideally, we would want the medication list to include the name of the medication and the purpose. Some medications actually have different purposes, especially if it's being used off-label. So that's why I would always include why you're taking it. It's helpful to know the size of your pill, how many pills you take, and how many times a day, what times you take those pills, so that way we can quickly screen it. We can literally screen it within 30 seconds and know what you're taking, rather than spend 10-15 minutes trying to figure out what was that new blood pressure medication they gave you in the ER. And that way we spend more time focusing on what's important for you, rather than something that could be easily written on a paperwork. And that'll save a lot of time. And personally, I do have some pearls that I personally find helpful to maximize a clinical visit. Being a nurse practitioner, I know we focus a lot on the medical care. But a lot of times people may not want to focus on the medical care, or they don't want to focus on, well, what medicine can you give me? We want to know, what else it is that we can help you with at home. So that's why it's helpful to bring somebody with you, as Adriana mentioned, to your visit. Again, it's very helpful for us in multiple reasons. And this is in no ways indicating that we think you're not capable of taking care of yourself. For me, I find it very helpful to know who's in your support network. And again, as Adriana mentioned, having two memories and two sets of ears is much better than one. So that way you can always talk to each other and be like, what was it that was recommended? What was it that was said? History is critical for us, because a lot of what we recommend is based off of the history that you provide us. And if the history is not accurate, our recommendations may not be the most optimal for you. One thing that people commonly tell me about bringing somebody to their visit, especially if it's a care partner that knows the patient very intimately, such as a spouse, a partner, is that they're afraid of revealing something that the person with Parkinson's doesn't want us to know, because it makes them look bad. I do want you to know that we're not here to pick sides. We're not here to make judgments. At least what I would like to think is that as a healthcare provider, we listen to both sides of the story. And then we base our judgment and recommendations on what we think is the most optimal for your quality of life. So we're not picking sides. So I do think it's helpful to allow the person who accompanies you to speak freely and be objective. I think that's very important. Rather than making any judgments, be very objective, such as, well, he's been on the computer all night and won't go to bed, rather than, well, I don't agree with him doing that. Just be very objective. So maybe they're right. Maybe you are on the computer too much and you don't recognize that you're being compulsive, or that you're, eating a pack of cookies every night. And you don't want your healthcare provider to know, because it's embarrassing. Don't be embarrassed. I am a person who believes in full transparency, because I think, as we know, secrets are never good. Secrets can build up and cause crisis, build a lot of animosity in people on your care team. And remember, your care team is going to be very critical, because those are the people that are going to be there to support you. And you don't want to alienate and make a weak care team. You want to make the care team strong. And I really believe that transparency is one way to do this. So even if it is embarrassing, that you eat a pack of cookies every night, allow them to share it. And the person sharing it, I would just advise you to be very objective and don't make any judgments that would make the person feel like more embarrassed than they really need to. And as healthcare providers, we are trained as well to be objective, to take into consideration both sides of the story and determine, is there something concerning or not. So please allow the person to talk. We can only help as much as we understand what's going on at home. And so as a movement disorder specialist, another pearl I can share is we know that we are relied upon in the community for information. We know that we are relied upon to know what's the latest and greatest in Parkinsonian research, what medications are in the pipeline. So we're used to being asked these types of questions. I always find it helpful if patients can make a list. Again, you make a list of these questions, and to make sure that a portion of your visit is dedicated to discuss non-medical, things that aren't directly related to you, that you bring it up at the beginning of your visit and have it all written out. So maybe there's a drug that you read about that you want to talk about, an article that you read that you want to discuss. I always find it helpful people tell me at the beginning that, hey, can we save a few minutes at the end of the visit or whenever you want? Save a few minutes during my visit because I have some questions that I read about that I want to talk to you about and kind of talk about. We're happy to be a resource. We're here for you, not just to talk about your medical care, but also to share what we know in the research community too. Happy to do it. Just would like a little warning so that we can make sure we save some time for your visit. And that way you feel like you've made the most use of your visit to address what you specifically want. And lastly, when you come to your medical visits, I always want people to think about what are their goals for care and make sure you share it with the team. So this means what's important to you, what's not important to you, what are your hopes, what are your goals, and most importantly, what are your fears? Because I think we don't talk about that enough. And the reason why that's important is because then we know who you are and we can make recommendations that are more compatible. Because I think a lot of conflict may come because we don't know what your fears are. Maybe our goals don't match up with your goals. For example, if we tell you you can't eat popcorn because you're at risk for aspiration, and you don't tell us that popcorn is like your most favorite thing in the world, I'm not going to take away your popcorn because I know it's important to you. But if I don't know that, I'm going to keep, making you feel bad that you're eating popcorn again because you're at risk for aspiration. We are not here to take away the joys in your life, but we won't know that unless you tell us. So that way, if you tell us popcorn is very important to me, it's one of my pleasures in life, then we know that we're not going to push it so much. I mean, we may still kind of encourage you not to eat it because we know you can aspirate, but just knowing that you understand the risks helps us. And that way we don't push harder to make you feel uncomfortable with what you're doing. Because our goal here is to be on the same team. Just remember that, just like what Adriana said, we're here to be on the same team, but we can't do that if we don't know what your goals are and what your fears are. I don't want to push something on you if in actuality you have a perfectly legitimate reason why you don't want to do what we're recommending. Sometimes maybe your fears need to be clarified. For example, I have people who are scared to start levodopa, and I need to find out why. And maybe there's a misconception. Maybe they think, well, if I start levodopa now, in 2 years, it won't work anymore. And that's not true at all. And then we'll clarify further what we think you're hearing and what we think you're learning. And again, education is very important. And maybe you'll realize like, oh, okay, so my fears weren't really justified and I can start the levodopa. And if they are justified, then that's where we have to brainstorm and be creative as a team. Well, how can we address your fears? Because we certainly want to take that into consideration. And this is where maybe all the other care team members need to come in, whether it's your social worker, your palliative care team, your therapist, maybe the rehab department needs to come in and help with some rehabbing, physical rehab. But without you telling us, we wouldn't know that. So I do encourage transparency, which I fully recognize is not something that we all have grown up with. We have all gotten used to doing, but you might as well just put it out in the front in the beginning, and that way all the shame or embarrassment or concerns or whatever you want to, whatever feelings you feel are eliminated at the beginning, and then you can move forward. And that's the one way you can move forward with your care, is by eliminating the unnecessary emotions that can actually hinder you. Shame can hinder you, embarrassment can hinder you. So if we can just address those at the very beginning, then we can move forward and help you live the best quality life that you can and focus on joy. instead of having those skeletons in the closet that nobody wants to talk about, but everybody knows is there. So I hope you found that helpful, because those are the things that I think are helpful when I see a patient that I wish people would know. So that way, when they come to a visit, you leave the clinic feeling like, wow, that was a good visit, rather than, well, I'm glad the doctor did what they wanted to, but I didn't get to address what I wanted to. So that was my hope of sharing all these things with you.